Now, there has been a marked rise in food poisoning cases in recent days. Over 70 pupils from various schools in Merafong were rushed to health facilities on Thursday after complaining of stomach cramps and diarrhea. The learners were part of a group attending a matric camp at Folkville Secondary School. This comes after the death of 5 kids in Naledi, Soweto, for allegedly consuming snacks from a spaza shop. For more on this, we're now joined by Carine Marks, who is the director of the Poison Information Centre. Carine, appreciate your time. Thanks so much for speaking to us. Firstly, would you briefly introduce yourself and explain your role as the director of the Poison Information Centre?
Yes, Hugo. Good afternoon. I'm the director of the Tigerberg Poison Centre, part of the National South African Poison Centre. We're based at Stellenbosch University. And we receive poison calls, from healthcare professionals and the public 24/7.
So I suppose it will be a good time for us to define what poison is, because in some of these incidents, I mean, there's obviously poisons that are deliberate. There's stuff that we know is poisonous, and then there are contaminated foods, such as the ones allegedly eaten by maybe these learners, and certainly the 5 children that died in Naledi Township. So what exactly does your area of expertise cover, or the Poison Centre cover?
Well, the father of toxicology says anything is Paracelsus, anything is poisonous, depends on the dose and the toxicity of the substance. Something like table salt can be poisonous if you eat the whole bottle of salt.
Okay.
And then again, these pesticides we're talking about, just a tiny little bit of that can cause a death.
All right, so what were your initial thoughts regarding the food poisoning incident involving the 74 grade 12 pupils from the Gauteng schools?
Pardon?
So what were your initial thoughts when you learnt of the 74 grade 12 pupils from Gauteng schools that were allegedly poisoned or consumed poisonous foods?
Through all my experience, I'm very careful when it comes to poisoning. We look at 2 things. Either you need to have the product and test for the product to confirm it is a pesticide. And then we also look at the symptoms. We call it detoxidrome. If we don't know what's involved, we looked at the symptoms that the patient is presenting with. No. So for me, I can't say there was definite poisoning or it was a pesticide, because to our knowledge, we don't know if the product's been tested. Post-mortem's been done. Stomach contents have been tested. And we don't know exactly the symptoms.
Now, what we are aware of is that there are a number of young people, primarily, who have been consuming various foods. Take the 5 children that died in Naledi in Soweto, for example. We go back a few months, and the number of cases are astronomical. In fact, I think in the last 30 or 60 days, somewhere I read that as many as 100 cases of food poisoning have been reported. What is it that we're not doing right?
We have a problem in South Africa, also in sub-Saharan Africa, other countries, what we call street pesticides, illegal street pesticides. So these are products that are actually manufactured for agricultural purposes, but they end up in the wrong hands. They are sold very cheaply on the streets. They're very effective in killing rats and cockroaches. And that gets in the hands of the wrong people. We know that certain of the sprays like dichlorphos, which is a very dangerous organophosphate, are being used to spray surfaces to kill cockroaches. So it could be that in these spaza shops, someone sprayed for cockroaches, for rats, and that's how the food got contaminated.
So as far as exploratory work that your department, your organisation would do, I'd imagine that you would take samples from the victims or those involved, or in the allegations of poisoning. Do you at all go back to the source of the poisoning?
It's difficult. It depends on which province we're talking. So in the Western Cape, we have at UCT forensic laboratory where they specifically look at the post-mortem, the stomach contents, the blood, to determine which pesticide was involved.
Now, the one thing that you mentioned seems to suggest that there's a possible contamination of foodstuffs by people in spaza shops or in other areas, for instance, that are selling foodstuffs but are also selling chemicals to either deal with cockroaches or rats and so on. Is there a policy or a guideline? Because if you walk into a regular supermarket, for instance, right, on the far end you would find soaps and other chemicals that potentially would contaminate food, and on the far end you'd find food. So it's never in the same place. Now, if you look at a typical spaza shop, it's potentially a 3x3. So it's very, very difficult to demarcate or protect the poisonous foods or foods that potentially, stuff that potentially could contaminate foods from that which doesn't.
Yes, and so any pesticide product also must remember that are used illegally. They're very, very, very toxic, but they are also sold in these shops and by street vendors next to sweets or toiletries. You know, so we need to be very careful. Also, a lot of these pesticides are decanted into different bottles, different packaging with no labels on. So we don't know, the person who's buying it don't know what they're buying, and they don't know the inherent toxicity of these substances.
Now, Carine, we've had these conversations for the last couple of years where individuals are poisoned or children eat contaminated food. And it doesn't appear that the public knows how to respond to cases of food poisoning and what steps should be taken to ensure the safety of affected individuals. So in cases of suspected food poisoning, I mean, firstly, what are the symptoms and what is your advice on how to deal with these individuals? We will listen to many parents speak about how their little children died in their arms because they didn't know how to deal, they couldn't read the symptoms.
Yes, indeed, and these pesticides are very, very toxic, so symptoms appear very quickly. So typically what we see with these organophosphates or carbamates is that they develop a toxidrome. We call it a cholinergic toxidrome. There's lots and lots of secretions, vomiting, diarrhea, but basically they die from bronchoria, which are actually wet lungs. So they need to be hospitalized as soon as possible, and very often they need to be intubated and ventilated. And by the time they reach hospital or the parents get transport to a hospital, it's too late.
So you're talking about being hospitalized. Many of these children were taken to clinics. Does the average clinic in South Africa, particularly in the townships, if you will, have the know-how on how to deal with these symptoms?
No, unfortunately not. A lot of our calls we get at the poison centers are from doctors at these clinics. They're not well educated in toxicology. It's not something they see often. It's not something that's in the curriculum when they study. So they don't know how to deal with it, and that's why the poison centers are valuable, because they will phone us, and there's always a healthcare professional from our side on call who would then advise the doctor step by step. But most of the time, we ask for immediate transferal to a tertiary hospital.
Carine Marks, Director of the Poison Information Centre, appreciate your time. Thank you so much for speaking to us and, unfortunately, confirming that most clinics do not have the adequate know-how to deal with challenges of poisoning or contamination of food. And that's where we leave it in this hour. Top of the hour reminder of the day's leading stories.